Thanks, Lynn, and thanks for the invitation to present today about trying to keep fit and trying to keep active during isolation. As Lynn said, my name is Matt Wallen. I'm a lecturer in exercise and sports science and an AEP, and my research is specifically driven towards using exercise as a therapeutic tool across a variety of different chronic conditions. So today I thought I'd just give an overview of the current evidence, what we know, and a few recommendations about what we should be doing during this time. Now, from the outset, and even before COVID-19, it was clear that a large proportion of Australia's population are increasingly sedentary and physically inactive. And this is because of a variety of different reasons, like increased time at work, for example, which I'm experiencing now from working at home, and also because we have more convenience of general necessity and amenities. And unfortunately, often regular exercise and physical activity are often the first things to go, as you know, we have to concentrate on our own lives and others' lives as well during these unprecedented times. And certainly for most individuals are social distancing, and they can see participate this as a barrier to participate in exercise during this time. And although everyone is sort of focusing on the health and well-being of themselves and others through social distancing to avoid transmission of the virus, we know that the evidence from living a sedentary lifestyle places us at a risk for developing chronic conditions like cardiovascular disease, obesity, poor fitness, and also impacts upon our overall mental health. At the moment, we're still trying to crunch the numbers about how this has impacted upon our overall sedentary activity, but certainly the numbers are showing that we are sitting a lot more and moving a lot less. Fortunately, though, regular participation in physical activity and exercise is shown to often mitigate a lot of these risks and the development of these future conditions. And in fact, moving someone from doing absolutely nothing to doing even small amounts of physical activity has shown to have a significant impact on that individual's health status. And collectively, this is shown to reduce the population-based risks for overall chronic conditions. Now, there's a myriad of benefits to participate in regular physical activity, and here's just a small list of them. One of the interesting things, though, is that with exercise, there's minimal side effects. So we often see with exercise and regular participation in exercise, increases in physical fitness, improvements in muscle size and bone health, improvements in immune defense, assist with weight loss and maintenance, improving balance, coordination, and overall improving mental health. I think one of the biggest take-home messages, if there's one point I want everyone to take home from the webinar today, is that doing some physical activity is better than doing absolutely no physical activity. And there's really no, I suppose, holy grail of exercise. There's no one exercise is the best exercise for everyone. Certainly we know that there's certain types of exercise that impact upon certain physiological and psychological systems in the body. But really the best exercise you can do is one that you'll engage with on a regular basis and incorporate into your day-to-day life for the rest of your life. So some of you might be aware of the general physical activity guidelines, but as a general recommendation, we need to be trying to engage in greater than or equal to 150 minutes of moderate physical activity per week, or 75 minutes of vigorous intensity physical activity. Again, you can also accumulate this in a combination of both moderate activity and vigorous physical activity. The final one that often gets left off this particular list is muscle strengthening exercises, and it's recommended from a public health standpoint that individuals are engaging with doing resistance training based exercise on 2 or more non-consecutive days of the week. Now, 150 minutes might seem like a lot of physical activity, particularly during COVID, you may not have done a lot of movement over the last few months. However, it's important to start off at a low intensity and something that you can maintain and regularly adhere towards, and gradually build this up over time, over a period of weeks and months, and trying to aim to meet these particular guidelines. It might be something as simple as going for a 10-minute walk around the block each day, and how if you gradually build this up over doing this in the morning and then again doing it at night, you'll nearly be at these recommendations if you do this every single day. One of the things I like to recommend is, even if you're stuck for time, like myself at the moment, you might want to consider what is called exercise snacking, where you perform short bursts of 2 to 3 minute blocks of exercise every 30 minutes during your workday, which if you crunch the numbers over an 8-hour shift, easily puts you at over 30 minutes of exercise per day. Now, this can be divided into multiple different ways, but the idea is to gradually accumulate activity over the period of the week. It's also important that if you were doing a fair bit of exercise prior to COVID-19 and social distancing, and you're thinking to get back to this level, make sure that you gradually work yourself up over a few weeks. The body's fantastic at trying to adapt to different circumstances in a positive way, and sometimes in not so much of a positive way. And the last thing you want is to get an injury when your motivation is at an all-time high to try and get back into exercise. One of the big questions that I often get asked is how hard should I actually push myself during exercise? And there's a few simple tools that you can use to try and work out what you need to be doing. As I mentioned before, moderate activity is generally recommended for most individuals. So using the talk test is a great tool that people can use without having to go buy fancy monitors to try and work out what exercise intensity you need to be working at. And for a moderate intensity exercise, you should be able to, if someone is standing next to you, you should be able to hold a conversation with them, but you can feel that your breath rate is starting to get up slightly. But you wouldn't necessarily be able to sing to the person next to you is a good way of trying to gauge what exercise intensity you need to be working at. The other way that may work for some people, other people might want to work on a sort of a 0 to 10 scale, where 0 is absolutely no difficulty, you're sitting down, you're not doing much at all, and 10 is an extreme difficulty, it's the hardest thing you've ever done. So using this perceived exertion, and ideally we want to be aiming for this 3 to 4 area of somewhat hard, moderate intensity or somewhat difficult intensity. So again, you should be able to talk to someone next to you, but you wouldn't be able to necessarily sing them a nice tune. One of the other things as well is to really be active in as many ways as possible. Things like, cycling, rowing, for example, running, going up and down stairs, going for your general walk around the block, weight training, skipping, as well as Tai Chi are fantastic options to participate in exercise and physical activity during this time. But as I mentioned before, remember, you need to pick something that's safe and it works for you. For some people, taking the dog for a walk is a great way to engage in physical activity, whereas others like to go to the complete opposite and do weight training in the morning and do running and cycling at night time. Whatever the exercise, make sure that you are enjoying it and it's something that you're going to be likely stick to over the long term. To sort of assist with some of options that you can do at home during this isolation period, the Exercise and Sports Science Australia, which is an accrediting body for exercise professionals, have developed a free online repository of home-based workouts that you can perform with no or absolutely minimal equipment at the following website, exerciseright.com.au, and there's some great workouts that you can perform that have been developed by accredited exercise physiologists and exercise scientists. But it's important that you don't need to go spend hundreds and thousands of dollars on exercise equipment to have a great workout at home. So things like equipment that you could adapt in the home environment that you could use, for example, so tinned food, filling up 1 and 2 litre milk containers, laundry detergent containers, and rice and flour packets to use as dumbbells, for example, can be useful. If you're doing squats and lunges at home, filling up a backpack with some small weights and other objects can be a great tool to try and increase exercise intensity. If you've got stairs, and most people will have some stairs, using it for step ups. So you can use it as a strength training exercise by adding a few weights, or you can use it as an aerobic or cardiovascular based exercise, where you don't have the weights and you repeat them for longer periods of time. Laundry basket filled with clothes are fantastic for doing exercises like deadlifts. And I suppose one of the go-to pieces of exercise equipment that most people will have in their house is their own couch, which you can use for a variety of types of exercises as a bench or support for bodyweight exercises like push-ups, different types and variations of squat techniques, tricep dips, for example. And finally, a good one is going up and down hills, which are a fantastic way to get an interval-based exercise prescription into your daily routine. It's important though that exercise, I suppose any therapy, does come with some risks, and it's also important to understand these before you go off and engage in your active lifestyle. The number one thing with exercise is that your safety is the priority in this case. So it's important that you have an awareness of any diagnosed medical conditions that you may be aware of. Different types of medications can alter how the exercise response occurs, whether you've got pre-existing injuries or even conditions that may be exacerbated by exercise. And it's also important to understand that if you haven't done a lot of physical activity in the past, going out and doing a sprint session is probably not the best thing for you to do, and exercise needs to be graded according to your level of physical activity. So pre-existing, it's important that individuals have aware of their conditions, and so I'd recommend at least having a run through, I'll show you in a second, of a series of a small questionnaire to pre-screen to see if you may have one or multiple of these conditions, and that you may need to seek medical clearance before you should go and engage in regular exercise. One of the important things, though, is that we don't know the impact that exercise has in individuals that have actually contracted COVID-19. So if you currently have a diagnosis of COVID-19, you should not exercise during this time, or if you have similar symptoms like this. This is the tool that I'd recommend you have a look at, and I've attached the website down the bottom that hopefully these slides get disseminated later that you can look through. And it's what's called the Adult Pre-Screening System. And basically it asks 6 small questions about your medical history, including whether you've had a stroke or a heart attack, for example. Have you had an asthma attack in the last 12 months, or have you got uncontrolled diabetes? In the case that you do tick yes to one of these boxes, it's certainly recommended to consult an exercise professional like an exercise physiologist or a physiotherapist, or your GP before commencing exercise. If you don't tick any of these boxes, if no, then for general recommendations, it's fine for you to participate in low or light to moderate intensity activity, or if you've been advised otherwise, higher intensity activity, if that's what suits you. It's also important to understand that during exercise, that if you are experiencing any signs and symptoms like abnormal chest pain, for example, excessive shortness of breath, lightheadedness, and abnormal dizziness, you should stop exercise immediately and seek medical care. And during COVID-19, there's obviously been recently a slight easing of restrictions, or this may actually go back up. We're sort of in this state of limbo at the moment. But it's important that you are adhering to social distancing laws for COVID. So at home, in gyms, for example, as well as outside in parks and using public exercise equipment. It's super important to limit the transmission of COVID-19, so maintaining excellent hand hygiene is very important, as well as cleaning your exercise equipment once you've actually finished with it. To summarize everything, being in isolation doesn't mean that you have to be physically inactive, and engaging in regular physical activity has a myriad of physical and psychosocial benefits. Um, one of my number one take home things is doing some activity is better than doing absolutely no activity, and pick an exercise or an activity that is safe, that you enjoy, and that you'll perform regularly. And finally, if you're uncertain about anything to do with exercise, or any conditions that you might have that you think might be made worse by exercise, it's important that you contact an exercise professional, or your GP to make sure that everything is good to go. And thank you.
Great. Yeah, great, Matt. That's just been a wonderful overview and very, inspiring. Certainly, I'm thinking about that, taking those breaks, or not breaks, but doing exercise in those bite-sized bits during the day, rather than thinking I've got to set aside a whole hour and I don't have that. And so, doing those bite-sized chunks is a really good idea. If anyone's got any questions, please let us know. I can see Sam is saying, what about everyday and useful activities such as gardening and, in his case, keeping a wood fire going during the winter months? So, can you count those as part of your 75 minutes?
Yeah, you can contribute towards probably more your 150 minutes. Certainly, if you're finding that the your breath is starting to get up a little bit, maybe you're doing some vigorous vacuuming, or you're doing some wood chopping to try and stoke that fire, for example. Yeah, then certainly you can count those things together. And they're fantastic options, particularly if you don't necessarily have exercise equipment, but you still want to try and maintain an active lifestyle, whilst being or unable to sort of go outside too much.
Yeah, and tell me a little bit more about what an exercise physiologist does.
Yeah, sure. So, an exercise physiologist uses exercise to treat a variety of chronic conditions. So, for instance, I suppose, specialization is in cardiovascular disease, and cancer. And so I use exercise, specifically dosed exercise, so at correct intensities and correct durations and correct volumes, to try and mitigate, or try and improve their fitness levels, and they also have a lot of benefits towards improving overall cardiovascular health. We essentially use exercise as a therapeutic tool, similar to what you would a medication. And like medications, often we get our evidence-based practice from the research. And so we use this to try and assist individuals with living their lives maybe with a chronic condition.
Mm. Yeah, and you were saying that it's important to use the things around the house as well, and you mentioned the couch, but I just wondered about how we're safe in doing those things. Sometimes you've got a couch that you could lean back on and connect to do those exercises, but sometimes they can be quite you'd have to be sure that it was not going to give way on you, sort of thing.
Certainly. Yeah, it's all relative to what you've got, really. As I said, if you think at any point in time that the exercise that you're doing is unsafe or unsturdy, then it's probably best to consult someone. At the moment, a lot of exercise physiologists and physiotherapists are actually doing telehealth consultations.
Oh, yes.
That can be quite useful, particularly if you're unsure about anything. So it means that you can get an evaluation of your overall health. You can get an exercise program written for you, and then they can also assess what you've got at home that is probably the best thing for you to use. But certainly, yes, I agree that there are some pieces of equipment. For example, this swivel chair I'm on wouldn't exactly be the greatest thing to be doing squats and single leg lunges on, for example.
Yeah, that's right. And Denise asks, is yoga considered easy or moderate exercise?
It would be considered a low intensity based exercise. Certainly, there are some evidence to show that shifting from doing no activity to doing some activity, like participating in yoga, can offer health benefits. And certainly, there are benefits from a psychosocial standpoint as well. And by
Mm.
doing mindfulness and concentrating on the technique, can offer a lot of mental health benefits.
Yeah, and I think you get much more flexibility from yoga than you do, with any other sort of gym type exercise as well. So there's other benefits, I suppose. And so Jason asks, as you mentioned, some exercise is better than none, but how do you approach engaging the inactive in beginning, taking that first step to exercise?
Yeah, certainly. It's often one of the challenging things that we face as exercise professionals to try and get people from doing something to doing nothing. Certainly, um, on a model of behavior change, if people are thinking about exercise, that's sort of the first step in moving people forward. But often starting off with small things, aiming to achieve small, meaningful goals that can easily be achieved and gradually working up over a period of time. Talking the individual through the things that they can achieve rather than focusing on bigger picture things can often be a good starting point. And so little wins along the way is the best way of trying to get people to meet those big targets of 150 minutes of physical activity.
Mm, yes, exactly. Yes, yeah. And so, do you have any sort of final comments then for us as because I feel that given uh, the time that we're in, I know for me, I was thinking last week, oh, it looks like we're going to get back into the gym, and it's not going to be too long before I can do that. And now all of a sudden it seems like, it's not going to happen again for quite a while. So I know that you said some gyms are opening, but I'm just thinking about that sort of mindset of keeping going even in this time when yeah, it's disappointing
Yeah,
time, I suppose.
it's challenging and it's something that like I don't think anyone has really sort of seen this fluctuation in there. You can go out and you can come home and what do you do from that? I think the main thing is that always have something in the back pocket. Always think about stuff that you can do at home. Yes, it would be fantastic to go to the gym, but even if you know that there may be sort of a fluidity to when gyms and things can open, always know that there are alternatives out there that can be used specifically around Ballarat as well. Um, and I think, engaging as the main message that I suppose I'm getting from this is engaging with something is better than doing absolutely nothing. And that's
Mm.
probably the big thing I want people to get from this.
Yes, and we just have to keep ourselves, up, I suppose,
Yeah,
during this time. And we know, I mean, the good thing is with exercise is that it actually supports our mental health as well as our physical health, as you said. And so just getting moving is really important. Yeah, yeah. So. Good. All right. Well, thank you so much, Matt. I'm just going to finish with a mindfulness practice and then I'll let people know who's giving our next webinar. We're actually almost coming to the end of our webinars. We've only got two more left in this series. So I'll tell you a little bit more about who's going to um, finish or take those last two webinars. And so thanks. This has been I think it's been very timely to have this conversation, and I'm really grateful for it. So thank you, Matt.
it's okay.
The mindfulness practice I wanted to take people through today is one actually specifically designed to elicit compassion for ourselves and others. So we want to just again take time to um, ground our feet, to sit back in the chair, to take that deep breath and to settle the mind. And we want to just repeat these following phrases. May I be happy. May I be peaceful. May I be free from suffering. So as you say each phrase in your mind, see if you can imagine breathing warmth and compassion into your heart, and then breathing out warmth and compassion towards yourself as you say, may I be happy, may I be peaceful, may I be free from suffering. So on the next round, we're going to direct those same phrases to someone who's very close to you. Could be a family member or a close friend. So with that person in mind, bring that person to mind and say to them, or say in your own mind, may you be happy, may you be peaceful, may you be free from suffering. And then finally, picking a person or a group that you don't know well. Perhaps it's a neighbour you don't see, but you see, but you don't know much about them. And if this uncovers any unconscious biases, then you can practice compassion for the people you may judge, like certain ethnic groups or socially disadvantaged groups. Again, repeating the phrases for this person or group. May you be happy. May you be peaceful. May you be free from suffering. So this simple practice, which doesn't take very long but is very helpful, has been used by researchers to generate positive emotions and has also been used or has been shown to reduce implicit bias towards stigmatised groups such as Indigenous or homeless people, which we all know is very relevant at this time. So many thanks, Matt. And as I mentioned, next week will be our second last week, and we'll be joined by Tara Poole, who's the coordinator of Ballarat's Creative Cities Initiative. Tara will be speaking about the good and bad of COVID and how we as a community can continue to grow our social and creative lives post-coronavirus. And then on our last week we'll finish as we started with the psychologist Kate Skilbeck, who will be joining us for the final webinar. So and if you're interested in learning about the work of Compassionate Ballarat, then please send an email to info@compassionateballarat.com.au, and Denise White, who does all our wonderful marketing work, will ensure that you get put onto our database. So thanks everyone, and thanks again, Matt. That's just fabulous. Thank you now. Bye.
Bye.